I'm about to tell you something that might save your life, and I don't say that lightly. Right now, while you're watching this video, there's probably a pill sitting in your medicine cabinet. A pill you took this morning, a pill your doctor prescribed, a pill millions of seniors take every single day. And that pill, it might be slowly, silently, permanently destroying your heart. Not irritating it, not slightly increasing risk, destroying it. And the worst part, you won't feel a single thing until the day you collapse. My name is Dr. Claire Whitmore. After 20 years as a cardiac surgeon, I've held thousands of hearts in my hands. Healthy hearts, weak hearts, failing hearts. But there's one type that haunts me the most. Hearts that should have been perfectly fine, but were destroyed by a medication that was supposed to help. And here's what terrifies me. Every patient says the exact same sentence. My doctor said it was safe. My doctor said I needed it. My doctor never told me it could hurt my heart. Now you're probably thinking, just tell me the name of the pill. Not yet. Because if I say the name right now, half of you will check your cabinet, see you're not taking that exact drug, and click away thinking you're safe, but you're not. Because there aren't just one, there are 7. 7 common medications, all routinely prescribed, all considered normal, all quietly damaging senior hearts every single day. And by the end of this video, you'll know every single one. But first, you need to understand what this damage actually looks like. Because once you see it, you'll never look at your prescriptions the same way again. William. Let me tell you about William. William was 72, retired postal worker, never smoked, rarely drank, walked every morning, healthy weight. Honestly, he was healthier than most 50-year-olds, but he had bad arthritis in his knees. Every step hurt. Getting out of bed hurt. Walking to the mailbox hurt. Playing with his grandkids hurt. So his doctor said, William, I'm going to give you something for the pain. It'll help you stay active. It's safe. William trusted him. Of course he did. We're taught to trust doctors. He started the medication. And it worked. Pain dropped fast. Within weeks, he felt normal again. He could garden, walk, play with his grandchildren. For the first time in years, he felt free. So he kept taking it. Every day, morning and night, for 3 years. Never missed a dose. Exactly like his doctor said. But something was happening inside his chest. Something invisible. Something silent. Something deadly. Every dose made his blood vessels tighten just a little. Every dose made him retain just a little more fluid. Every dose forced his heart to pump just a little harder. Not enough to feel, not enough to notice, but enough to slowly overwork the heart muscle, 24 hours a day, for years. Think about it like this. Imagine jogging, not sprinting, just jogging, but never stopping. Not for sleep, not for rest, not for 3 straight years. Eventually, your muscles fail. That's exactly what his heart was doing. At first, his heart compensated. The heart is incredible. It adapts, it pushes through. But there's a limit, especially after 70, because by that age, you don't have reserve capacity anymore. At 30, your heart might work at 50%. At 70, you're already using 85-90% just living. So when a medication demands 10-15% more, there's nowhere to get it from. There's no buffer. Something breaks. The first symptom? Fatigue. Just a little. Walking up the driveway made him winded. He blamed aging. We all do. Then came the nights. He couldn't lie flat. Every time he laid down, it felt like he was drowning, like someone put a weight on his chest. He started sleeping with 2 pillows, then 3, then sitting upright. Here's what was really happening, and this is the part nobody ever explains. Fluid was filling his lungs because his weakened heart couldn't pump blood forward, so blood backed up. Fluid leaked into lung tissue. Every night, he was literally drowning in his own body, and the medication for his knees, it was making it worse. Every pill, more fluid, more pressure, more strain, more damage. Until one Saturday morning, everything collapsed. He stood up in his garage, felt dizzy, vision went dark, and dropped to the floor. Ambulance, oxygen mask, blood pressure crashing, lungs full of fluid. At the hospital, the cardiologist ran an echocardiogram. Normal ejection fraction, 60%. Williams, 25%. His heart was barely pumping. Enlarged, stretched, weak, years of damage, irreversible. Then came the question, what medications is he taking? His wife listed them. And when she named the arthritis drug, the cardiologist stopped, closed his eyes, and said quietly, that medication causes heart failure. 3 years. 3 years on a drug with known cardiac risk. No monitoring, no warning, no heart checks, just automatic refills. William is alive today, but he doesn't live. He can't walk stairs, can't carry groceries, can't play with his grandkids. He sleeps sitting up so he doesn't suffocate. he takes 7 heart medications for the rest of his life. Because one safe pain pill destroyed his heart. And here's the part that should make you furious. There were safer options. Physical therapy, topical creams, acetaminophen, injections. But nobody offered them. Because writing a prescription is easier. Now imagine this. If one simple pill for knee pain can do this, what else are we taking that we've never questioned? And remember, I still haven't told you the name of that medication. Because William is only story number 1. There are 6 more. And the next one? It doesn't just weaken the heart. It actually kills heart muscle permanently, creates dead tissue that never comes back. Now let me tell you about Dorothy, because what happened to Dorothy is even worse. William's heart got weaker, but Dorothy, parts of her heart actually died. Permanently. Dead muscle. Scar tissue. Gone forever. Dorothy was 68. Grandmother. Church volunteer. Walked every morning with her friends. She wasn't sick. She didn't feel bad. She just had slightly high blood pressure. 142/88. Not dangerous, not urgent, not life-threatening. Honestly, at her age, many doctors would simply monitor it, encourage walking, maybe adjust diet, but instead her doctor said, "Let's be proactive. I'll start you on medication. We'll get those numbers perfect." And Dorothy trusted him, because that's what we do. We trust the white coat. She started the pill every morning, like clockwork. And it worked beautifully. Within weeks, 128/78. Perfect, her doctor said. Keep taking it. Dorothy felt proud. She thought, I'm doing everything right. I'm taking care of my health. But inside her chest, something catastrophic was happening, and nobody was watching. This medication worked by blocking calcium channels. Now that sounds harmless, but here's what most people, and honestly most doctors, don't fully understand. Your heart runs on calcium. Every single heartbeat depends on calcium entering heart muscle cells. Calcium is what allows the heart to squeeze. No calcium, no contraction. No contraction, no pumping. So when you block calcium channels, you weaken every single heartbeat, just a little, not enough to notice, but enough to matter. Imagine trying to squeeze a stress ball, but someone reduces your hand strength by 10%. You can still squeeze, but it's weaker. Now do that 100,000 times a day, every day, for years. Eventually, your hand fails. That's exactly what happens to the heart. For 4 years, Dorothy took this medication every day. 4 years of weaker contractions, 4 years of heart muscle strain, 4 years of cells slowly dying. And here's the part nobody tells you. Heart muscle does not regenerate. When heart cells die, they don't grow back. They're replaced with scar tissue. Scar tissue doesn't pump, doesn't contract, doesn't help. It just sits there, dead weight. So Dorothy's heart wasn't just getting weak. It was literally being replaced, piece by piece, with useless tissue. But she didn't feel anything. That's what makes this so evil. No pain, no warning, nothing obvious. Your heart compensates. The remaining healthy muscle works harder. You feel normal. Meanwhile, damage is spreading. Then came the fatigue. She stopped finishing her walks, needed breaks, felt exhausted all the time. Doctor said, "You're just aging." That phrase. I hate that phrase because just aging hides so much damage. Then one day at the grocery store, it happened. She reached for a box on a shelf, felt a strange flutter in her chest, like a bird trapped inside her ribs. Her heart started racing, skipping, pounding. Her vision blurred and she collapsed. Right there in the aisle. Paramedics rushed her to the hospital. EKG showed atrial fibrillation, heart rate 180, chaotic rhythm, dangerously unstable. They did an echocardiogram, and the cardiologist's face changed immediately. He knew, before he even said anything, her heart isn't supposed to look like that. Thin walls, stretched chamber, barely squeezing, large areas not moving at all, dead zones. Normal ejection fraction, 60%, Dorothy's, 30%, half a heart, half alive. The cardiologist asked the question, "What medications are you taking?" She listed them. He stopped at the calcium channel blocker. How long? 4 years. Silence. Then, that medication can cause cardiomyopathy, especially in older adults. Especially in older adults. Not in the commercials, not in the pamphlets, not in the cheerful pharmacy handout. Her heart muscle had been slowly dying for 4 years, and nobody checked. Not once. No heart ultrasound, no monitoring, nothing. She stopped the medication immediately, but here's the cruel truth. Stopping doesn't reverse damage. Dead heart muscle stays dead. Forever. Today, Dorothy can't walk a block, can't travel, can't play with her grandkids, needs heart failure medications for life, and she's not eligible for transplant. Too old, too risky, all because her blood pressure was 14 points high. 14. Was that worth destroying her heart? Of course not. But this trait happens every day. Now think about this carefully. She wasn't sick. She didn't feel bad. She wasn't dying. She went to the doctor to prevent problems. And the treatment caused the disaster. And we're only on medication number 2, because the next one might be even more common. Millions take it. You might be taking it right now. It's for something simple. Something almost everyone has. Heartburn. Acid reflux. Just stomach issues, right? Wrong. Because this one doesn't weaken the heart. It messes with your heart's electricity. And once the damage starts, it almost never stops. Now let me tell you about James. Because James didn't take a pain pill, he didn't take a blood pressure pill, he didn't take a heart medication, he took something most people consider completely harmless. Something millions of seniors take every morning without thinking twice. Something you can buy over the counter, something for heartburn. Acid reflux. Just stomach acid. Nothing to do with the heart, or so he thought. James was 76, retired teacher. Quiet life. Loved reading, gardening, morning walks with his wife, but he had reflux, burning in his chest at night, acid taste in his throat, kept him awake, uncomfortable, annoying. His doctor said very casually, "I'll give you something stronger. It shuts off stomach acid completely. You'll feel better fast." And he did. Within days, the burning was gone, like magic. James thought it was a miracle pill. He told everyone about it. "I wish I'd started this years ago." He took it every single day. 1 pill every morning for 8 years. And during those 8 years, something invisible was happening inside his body. Not pain, not symptoms, not discomfort, just slow depletion. Here's what most people, and many doctors, never explain. Stomach acid isn't just for digestion. It helps you absorb minerals, especially one very important mineral, magnesium. Magnesium controls your heart's electrical system. Every heartbeat, every rhythm, every coordinated squeeze depends on magnesium. Without enough magnesium, your heart's electrical signals become unstable, chaotic, unpredictable, like faulty wiring in a house. Lights flicker, circuits misfire. Eventually, something shorts out. That's what happened to James. His medication blocked acid, blocked magnesium absorption. And slowly, month after month, year after year, his magnesium stores drained. Nobody checked, nobody tested, nobody warned him. Then one evening, sitting in his living room, watching television, it started. His heart began fluttering. Not fast like exercise, not steady, just chaotic, skipping, racing, thumping out of rhythm. He stood up, got dizzy, sat back down, thought maybe anxiety, maybe caffeine, but it didn't stop. It got worse. His wife called emergency services. At the hospital, the monitor showed atrial fibrillation. The top chambers of his heart weren't beating. They were quivering. Hundreds of tiny, useless movements. Blood pooling instead of flowing. And here's why that's dangerous. When blood doesn't flow, it forms clots. And those clots can travel to the brain, blocking blood supply, causing catastrophic events. They tried medications, they tried procedures, but the rhythm wouldn't return to normal. Because once this rhythm starts, it often becomes permanent. Blood tests finally showed the answer. His magnesium was critically low, dangerously low. The cardiologist asked, "How long have you been on this reflux medication?" 8 years. The doctor nodded slowly. That explains it. They stopped the medication immediately, started magnesium, but the damage was already done. Today, James still lives with that irregular rhythm. Every day, he takes blood thinners for safety, needs constant monitoring, gets tired easily, and always worries about what might happen next, all from a pill for heartburn. Now, I want you to pause, because this is important. James didn't take anything dangerous. He didn't take a heart drug. He didn't take something exotic. He took something advertised during the evening news, something your neighbor probably takes, something your spouse might be taking right now, and it quietly changed his heart's rhythm forever. So now you've heard 3 stories, 3 different people, 3 completely different medications, Three completely different mechanisms, but the same ending: a damaged heart, a reduced life, a future they never expected. And here's what all three had in common. None of them were warned. None of them were monitored. All of them trusted the prescription. That's what scares me most. Not the medications themselves, but the silence around them. Because seniors are different. Our bodies process drugs differently. Our hearts have less reserve, less cushion, less margin for error. What might be fine at 45 can overwhelm the heart at 75. And that's why the same prescription that helps one person can quietly harm another. So now, it's time to stop the stories and give you something practical, clear, actionable. No drama, just facts. Here are the medications you need to review with your doctor. Not panic, not stop suddenly, but review, ask questions, discuss safer options. First, common anti-inflammatory pain pills: ibuprofen, naproxen, diclofenac, meloxicam. These can increase fluid retention, raise blood pressure, and make the heart work harder. For younger people, often tolerated. For seniors, sometimes too much strain. Second, certain calcium channel blockers like diltiazem and verapamil. These can weaken heart contractions in some older adults, especially with long-term use. Monitoring heart function becomes important. Third, long-term proton pump inhibitors for reflux. They may lower magnesium over time, and low magnesium can affect heart rhythm. If used long-term, it's wise to check levels regularly. Fourth, some older diabetes medications that promote fluid retention. In people with heart issues, this can add extra strain. There may be newer alternatives worth discussing. Fifth, older tricyclic antidepressants. They can affect heart rhythm in sensitive individuals. Modern options often have a safer profile. Sixth, certain rhythm control medications that paradoxically stress the heart in some cases. Again, this requires careful supervision. And finally, any medication taken long-term without review, because risk isn't only about the drug. It's about duration, age, combination with other pills, and lack of monitoring. Here's what I recommend. Tonight, open your medicine cabinet. Write everything down, every pill, every supplement, every prescription. Take that list to your doctor and calmly ask, do I still need all of these? Are there safer alternatives? Should we monitor my heart? Can any doses be reduced? Not fear, not rebellion, just informed conversation. Because your heart deserves protection, not surprises. And in the next video, I'm going to show you exactly which simple blood tests and checkups can catch heart strain early, before symptoms, before hospital visits, before permanent damage. If you value your independence, your energy, your time with family,